Everyone, Assalamualaikum. Ultrascan Diagnostics said this is the CBCT of the patient that you had requested. The area of interest has not been highlighted, but we give you a quick idea. The posterior region on the right hand side, right here, distal to the premolar region. The premolar is the last tooth where any kind of um, implant dentistry can be done. Um, if the premolar is mesial to the premolar, we've got a relative ridge width in the canine region of 6 millimeters of width with 10 millimeters of height. Then we move on to the central incisor region. Very poor bone quality here, but we've got 5 millimeters of width with 9 millimeters of height. Moving to the central on the left hand side, again we've got 6 millimeters of width with 8 millimeters of height, and then the canine region right here on the left hand side. Very poor bone quality here. 4 millimeters of ridge width with 10 millimeters of height, and then when we move towards the premolar and molar, again absolutely no bone on the top. The lower left also cannot support any implants. Very poor bone quality. The anterior region in the lower left area, we've got a very knife edge. You go very deep, and then we get approximately 6 millimeters of width with just 8 millimeters of height. And this is the lower left central region, lateral region. This is the lower left central, again very thin ridge. This is the lower right central, again extremely thin ridge here also. We've got just 3 millimeters of width with 12 millimeters of height, and the lower left segment again we've got severe periodontal bone loss and no bone for implant placement.